the big thing when you're talking about periods is just to know if it's normal or abnormal. If you know it's abnormal, then you can find the help that you need. So a normal menstrual cycle is anywhere from 21 to 35 days. So if you're having menstrual periods that are shorter than that duration or longer than that duration, that would qualify you as irregular periods, and that should probably get looked into. A common misconception is that after you take birth control pills, or if you've taken them for a long period of time, that you think that's why it's keeping you from getting pregnant. That could not be more far from the truth. Taking combination oral contraceptives is not going to cause any kind of problem. And in fact, we see a lot of pregnancy rate after stopping those birth control pills. The Mirena, Liletta, the other class of IUDs are progesterone only. These ones affect you a little bit differently, and it can take up to 6 months for your periods to get regulated after you take that. It does not affect future fertility. So PCOS is very complex, very complicated. So Polycystic Ovarian Syndrome is what that stands for. Providers are starting to kind of separate them into PCO, so polycystic ovaries, and PCOS, so polycystic ovarian syndrome. Polycystic ovarian syndrome kind of encompasses PCOS as a metabolic disorder. And PCO is just kind of if you have those cysts on your ovaries, right? So polycystic ovaries is when you have a bunch of small fluid-filled cysts on your ovaries that don't tend to regenerate and go away from month to month. But you just want to maintain that healthy weight, do light exercise, watch your diet, decrease stress. Don't do any of that high endurance exercising, because that can actually not be that good for your body, right? There's a reason why things like CrossFit and stuff is so hard. It's because it's hard on your body too. So when you're trying to get pregnant, just be careful with that really hard, intense exercise.